Like all medications, aspirin can cause side effects. Some common side effects of aspirin include 1. Upset stomach. Aspirin can irritate the stomach lining and cause nausea, vomiting, and stomach pain. 1. Taking aspirin with food can help reduce these symptoms. 2. Heartburn. Aspirin can cause acid reflux and heartburn, especially when taken in high doses. 3. Headache. Paradoxically, aspirin can cause headaches in some people, especially if it is taken too frequently or in high doses. 4. Dizziness. Aspirin can cause dizziness and lightheadedness, especially if the person stands up quickly after sitting or lying down. 5. Rash. Some people may develop a rash or hives after taking aspirin, indicating an allergic reaction. 6. Bleeding. Aspirin can increase the risk of bleeding, especially when taken in high doses or in combination with other medications that also increase the risk of bleeding. In addition to these common side effects, aspirin can also cause more serious side effects in some people. These include 1. Stomach ulcers. Long-term use of aspirin can cause stomach ulcers and bleeding, which can be life-threatening in some cases. 2. Kidney damage. Aspirin can cause kidney damage, especially in people who already have kidney disease. 3. Liver damage. Rarely, aspirin can cause liver damage, particularly in people who take high doses of the medication or who have pre-existing liver disease. 4. Increased risk of bleeding in the brain. Aspirin can increase the risk of bleeding in the brain, particularly in people who have a history of stroke or who are taking blood thinners. It is important to talk to a healthcare provider if you experience any side effects from taking aspirin, particularly if they are severe or persistent. Precautions for taking aspirin. There are several precautions that should be taken when taking aspirin, including 1. Avoiding alcohol. Alcohol can increase the risk of stomach bleeding when taken with aspirin. 2. Avoiding other blood thinners. Taking other blood thinners, such as warfarin or heparin, with aspirin can increase the risk of bleeding. 3. Taking aspirin with food. Taking aspirin with food can help reduce stomach irritation. 4. Avoiding aspirin during pregnancy. Aspirin should be avoided during pregnancy, especially in the third trimester, as it can harm the developing fetus. 5. Consulting a healthcare provider. It is important to consult a healthcare provider before taking aspirin if you have any pre-existing medical conditions, such as kidney or liver disease, or if you are taking other medications. Interactions with other medications. Aspirin can interact with other medications, including 1. Blood thinners. Aspirin can increase the risk of bleeding when taken with blood thinners, such as warfarin. 2. Non-steroidal anti-inflammatory drugs, NSAIDs. Taking other NSAIDs, such as ibuprofen or naproxen, with aspirin can increase the risk of side effects. 3. Steroids. Aspirin can increase the risk of stomach bleeding when taken with steroids, such as prednisone. 4. ACE inhibitors. Aspirin can reduce the effectiveness of ACE inhibitors, which are medications used to treat high blood pressure and heart failure. It is important to inform a healthcare provider of all medications, vitamins, and supplements that you are taking before starting aspirin or any other medication. Conclusion. Aspirin is a widely used medication for the relief of pain, fever, and inflammation. It works by inhibiting the production of prostaglandins, which are substances in the body that cause pain and inflammation. While aspirin is generally safe and effective, it can cause side effects, particularly in high doses.